I spoke to my GP the other day for my mental health. When I mentioned I thought this was a trauma response from having had cancer last year, he said, "What cancer did you have?" It's all in my notes. WTF. Okay, yes, I understand why that would feel so frustrating. You've been through cancer. You're now dealing with the emotional impact of that. And when you finally open up to talk to someone about it, the doctor doesn't even seem to know your history. And that can feel really dismissive. And it can feel like they haven't even done the basics. And honestly, sometimes it is a bit of a letdown. But this will be as much of a letdown for the doctor as it is for you. And here's the reality of how general practice works in the UK. We get 10 minutes per appointment. That's 10 minutes to read your notes, speak to you, actually listen, figure out what's going on, make a plan, document it properly, and maybe refer you or prescribe something, all before the next person walks in. And in real terms, that means you get about 6 or 7 minutes max. So when a doctor asks you something that's already in your record, it's not because they don't care. It's usually because they haven't had time to read through everything, or they want to hear it from you in your own words, rather than assuming from a summary or a headline. But under a system that's under this much pressure, it's not always possible to give every patient's backstory the time it deserves before the consult starts. So yes, I think it's a fair question to ask, especially if your GP doesn't know you well. But I also think it's fair to explain that most of us wish that we had more time to spend with you.